So moving quickly on, our last speaker in this little slot is Hansel. While she's are you mic'd up? Yeah. So Hansel's the Service Design Director at the Human Understanding Design Centre in Seoul, and I'm going to preempt the title of your talk. There we go. Design for Honourable Death. So please welcome Hansel. Thank you.
Thank you very much. Good afternoon. My name is Hansel Paeng. I'm Service Design Director of Human Understanding Design Center from Seoul Medical Center. Human Understanding Design Center is under Seoul Metropolitan Government Department of Medical and Health Policy. Today I'm going to share my stories through introduction of HUDC, and then most important perspective of when we design in hospital, and briefly introduce many projects of Human Understanding Design Center, and more focus on after stage about designing for honorable death, with sharing 3 different projects. And Seoul has 13 public hospitals, and each hospitals are different purposes, such as children's and geriatric, psychiatric, and specialized for tuberculosis, and dental hospital for disabled, and general hospital over 600 beds. And these public hospitals are open to everyone, but they especially provide services for the medically underprivileged, such as low-income earners and psychiatric patients, and homeless, victims of family violence, and North Korean defectors. The HUDC is in charge of improving these 13 public hospitals' experience through service design approach. And yes, I designed in a healthcare field around 10 years. Firstly, I started career with designing medical equipment, and I naturally moved to the private hospitals service and environment, such as emergency room and health screening center. For now, I'm working as a public healthcare service designer around 4 years. And today, I'm not going to show some successful design output. I just want to share my struggled challenges and when we deliver the idea to reality. So, for that, I want to share some embarrassing personal project 10 years ago, please understand. And when I began to have interest about the hospital design, I was thinking, why there are so many ugly things in a hospital? Yeah. Even that violate personal privacy. Patient gown, and then the stretcher cart. So among these ugly things, the strangest thing was urine collection bag. Yeah. Actually, patients holding a transparent plastic bag full of their yellow urine around. I thought I must redesign this bag for human dignity. I developed the whole exterior functions and materials of this bag, and with this new idea, I got International Design Award. At that time, I so much proud, and then I think I should do business with this, and it could be a jackpot. So I called many urine collection manufacturing companies, and then I explained my design and but dignity is really important, and then most of them ignored my ideas and hung up the call. But only one company listened to my idea carefully. I think he may be generous or needed free time to chat. Actually, after my explanation, he asked me a few questions. How much do patients have to pay for this product in daily basis? And who keep and manage this product? Nurses? Caregivers? And how do they dispose this bag? Can they reuse? I was shocked. Actually, I had considered for over a year, but in reality, there were tons of processes surrounding this little urine bag. So I realized that without considering entire experience of service, how fancy output is totally useless. From that time, I became more interested about the entire experience of healthcare industry, and I designed many medical services and process design until now. So we, HUDC, more focus on citizens' stage of entire healthy life instead of designing a single services. The stage that we are consider are stage of before citizens come into the hospital, and stage of at the hospital service experience, and stage of after hospital when citizens go back to their community. Before hospital, this is the preventive stage of medical service for the citizens. In this stage, awareness and accessibility of hospital are important. So we have long-term study of big data geometric information system analysis to know why medically underprivileged citizens harder to access to the public hospital, such as geographical living environments and transportations and specify of disease, and get together with contextual researches like observation and interview. So, and also we design a prevention and training manual for protect from infectious disaster like a 2015 MERS outbreak in Korea, and for the improving positive awareness of public hospital. Sometimes we hosted a make-a-thon competition together with over 100 Seoul citizens to solve problems of hospital. Through these events, we found over 20 funny and creative ideas. Actually, some of them are built startup company and keep developing the idea and got the invest. And then sometimes we had a test bed for goofy but creative healthcare startup who are harder to get a chance to meet and develop the idea with the hospital. I think that is a very important role of public hospital and public design center. And at the hospital, when citizens visit the hospital because of their illness, we provide easier and more comfortable services for them to receive medical treatments. For relief the nervous patients and caregiver who just entered the emergency room, we designed effective pathway for each group of patients, an intuitive sign system, and patient-centered waiting informations, and various type of communication tools for understanding a really complex ER process. This emergency room service design guideline applied to more than 10 ERs in Seoul now. Also we designed many communication tools for the North Korean defectors to receive the comfort healthcare service in Seoul without discrimination. And after stage of hospitalized, when citizens go back to their home, how they take care of their healthy life in their community care system. And we're trying to connect all the public healthcare service infra, such as nursing home, community healthcare center, visiting a community doctor service. We keep invest in these kind of community care service, but the more important thing is how these services are intensively connected each other to provide more powerful effect to citizens. So they don't need to come back again to hospital. Ironically, that is our goal. We don't need to come back to patient to our hospital. Yeah. So we design a complex healthcare policy to well design the service to help every citizen to maintain their healthy life, whether they are poor or rich, undereducated or educated, South Korean or North Korean. But nowadays, there is one subject that we are more focused on for this after hospitalized stage. That is, how could we design the moment of citizens' death be honorable? Why hospital consider this kind of subject? A briefly explanation of Korea's unique funeral culture. Family getting smaller, people begin to live in apartments, and hospital is getting bigger and bigger. Through this modernization of Seoul, the funeral home moved to inside of the hospital. When patients passed away, they moved to the hospital funeral home. Quite weird, but in Korean unique culture. Today, more than 80% of Seoul citizens have funeral service at the hospital. So the funeral service become a hospital service. And from Korean culture point of view, discussing someone's funeral before it passed away is quite rude. So we never say that F word. I mean, funeral F word. So funeral always are so confused and not prepared. So family members have to follow what is already setting in the hospital, almost the same setting. But most of hospital have been neglecting the funeral service because they just want to concentrate about the saving patient's life, not dealing with the death. So this is the reason why funeral are getting standardized without the charity and neglecting so long time in Korea. So we have a change this funeral culture in Seoul. When we first came up with this topic, we thought designing for death, that's cool. We could generate lots of innovative ideas. But for the generating ideas, we have to research what they need in the real situation and what is the core pain point of the funeral. But that was almost impossible to find out because the real situation of funeral atmosphere is quite dark and depressed and then so diverse. From the death of old men who lived comfortably for a long time to a child who died in an accident with sadness. So it was not easy to have observation and interview the family left behind, or it was not possible to discover the needs of people who passed away. So we begin to generate ideas without deep contextual research. So we generated quite fancy ideas like memorial media facade and invitation apps and some ideas like supporting families' sadness. When we plan to prototype these ideas, the giant hurdles waiting us. For first of all, when we introduce our ideas to funeral industry for cooperation, there are so many conservative stakeholders there, such as Institution of Korean Traditional Funerals and various religious groups, Buddhism and Catholic and Christians and private funeral service companies. They began to disagree every single ideas because they hated to change. They look at his hands. He really hate the change. And no one was willing to take the challenge of adapting a new idea as someone's once in a lifetime funeral, and hospital were not willing to take the risk either. One word, we failed, totally failed. So we admitted our hesitant challenge and decided to go back to basic. And we met all the conservative groups who disagreed with us and then suggested that please teach us about history and other traditional things and then discover together for the better funeral culture. So we began to studying the history of 5,000 years of Korean funeral culture as well as funeral service for the overseas together. We also conducted an in-depth interview with 40 citizens who had family funeral experiences. Actually, interview of funeral may recall the sensitive memories of individuals, so we passed IRB screening every single questionnaire to keep the ethic of research. When we understood about citizens' thoughts of funerals, we arranged interesting, creative workshop. We invited 50 citizens with a different age group to small theater. And these are different age group. And we asked the question to them, how would you design your own funeral? Yeah. And actually we asked this question through online survey at the same time. The answer was very interesting. The group 20s and early 30, they hope their funeral to be like a wedding party. Delicious finger food and favorite musics like K-pop. Yes, you know, Korea is hometown of BTS. And they hope their friends enjoy the party without crying. And group 30 and early 40, this group is probably the busiest generation. They frequently mentioned about rest and nature, ocean and freedom and forest, other kind of things. Group 40 and early 50, they kept mentioned about family and old friends and hometown and old memories. And then group 50s and early 60s, in this group, they begin to say about religion, actually close to the reality. And group 60 and early 70, this group was quite different atmosphere from 20s group. They felt very seriously about this question, and then they keep saying normally and similar with the others, or they want their funeral to be done without bothering their son and their daughter and their other guests. At the first, they had different opinion through each groups, but after that, the 20s and 70s are exchanged their thoughts and mixed the group, and eventually we were able to talk comfortably about what funeral we wanted. And then we had a prototype test with a short play about the funeral we wanted to design. and then we realized that if you know what I want and what my family want for the funeral, we could spend a meaningful time when we suddenly face the end of someone's life instead of confusing and just follow the standardized funeral. So after a year of study, we could have a meaningful project related to this topic. That was designing the first day experience in a hospice ward. We have many public hospice wards in Seoul, and recently in Korea, the law of life-sustaining treatment has been revised so that people can decide their own dignified death. However, the process of making this important decision is not yet smooth. And when patients first enter the hospice ward, a patient and caregiver face a really bad mood. They hard to admit their death, even if they already made a decision. At the beginning of this project, we were able to hear this from a patient's caregiver. I can never tell my mom that you are going to die soon. Actually, the biggest hurdle of this project was how to admit reality of facing death. And doctor, nurses, and social workers of hospice ward and HUDC, we begin to create communication kit for patient and their family. We focused on the patient and their family emotions and of first day and the whole journey until the last day of their life. Our communication kit looked like this. It seems like a present. We provide a communication kit with this bojagi when the first visit. Bojagi is Korean traditional packaging cloth. In past, when people give the heartful present to precious people, when wrapped it with this bojagi and then tie up in unique way. The way of tie up is very various, and it represents how much sincerity included. In Korean language, tie up my life is metaphorically meaning the finish and organize my life. So bojagi is very familiar to Korea, especially to elders. We collaborated with the expertise of bojagi and untied the bojagi. They can see the kit. We named it as a 담다. 담다 has a double meaning. Put something in or put some memories in their mind. So 담다 is very emotional word. The 담다 contains 3 separated books. First book is Put Caregiving In. First book contains educational information about caregiving. The book explains how patients change as they get closer to death and how caregivers deal with this change. If the caregiver understands these mental and physical change, it helps they could maintain good relationship with the patient during the last of day and make good memories without misunderstanding. Actually, that the misunderstanding issues are really bad in hospice ward. So we trying to figure out that kind of misunderstanding. So second book is Put Your Choices In. This book is contain a checklist of important decisions to make before a patient die, such as wills and advanced medical directives and way of funeral and assets, etc. And these decisions are made through consultation between hospice doctor and counselor. And third book is Put Your Life Memories in Their Family's Mind. This book is about filling out a page with the patient and the caregiver and the counselor. When this book is completed, a small biography is completed. So when patient passed away, caregiver could packing all this meaningful stuff with 보자기 and tie up their family's life, and they could keep it forever. And when family member passed away, we moved to the funeral home directly. So the second project was a funeral service design of citizens who do not have family to attend. To make a funeral in Korea, families need a lot of money and people to attend and help the funerals, but not every citizen have this kind of luck. I have heard this quite shocking mention from the interview with a homeless person. My whole life has been so pathetic without no money so far. Do I have to face such a miserable death? Not only homeless, but also many citizens were in a difficult situation to manage their family's funeral, such as a person without a family, a person who has no money to pay for it, or if left after families are too young or too old or have a disability, it is impossible to manage their funeral themselves. So we designed policy of public funeral service with no charge, together with welfare departments of Seoul City. It named 그리다, another Korean language. 그리다, a series of 담다. 그리다 is also has a double meaning. Meaning one is draw something, and then miss someone. So we provided 3 hours of funeral service according to their religion of their family, Buddhism, Christian, and Catholic. And then we provide a sincere ceremony of funeral and treat to a warm meal for those who attended. It may sound strange, but we try to empathize the feeling of people who passed away. He or she may have some regrets that they could not have enough space in their mind to offer even a warm meal to friends generously. So we prepare a warm meal to attendee with this message. And then we thought with this treat, he or she can live their way comfortably. And also we have a time to share their memories and letters. But the reality, delivered to real policy, the biggest hurdle of this project was to find the space for the 3-hour funeral service and to find people to accompany for a homeless man's funeral. Hospice funeral hall always fully utilized, and usually hospital rents a funeral service room for 3 days, because Korean usually funeral are 3 days ceremony. So 3-hour funeral service is harder to arrange. So we had lots of arguments with funeral hall, and then finally we build different separated rooms to use for the public. And thankfully for the company, I mentioned before, the conservative thing. We are friends now, so they helped us. They supported religious people to lead funeral and bring some students to volunteer for the sincere ceremony. And up to now, we had only 2 funeral services with this setting. The first case of our service was no family. The man was a North Korean defector, but unfortunately, there was no family and no friends to attend. So we invited local neighborhood to a funeral service, not to be lonely for his last way. And second case of funeral service was for low-income family. When we finished the 3 hours funeral, the families show much appreciation to us to provide these services. Actually, that was very meaningful and honorable to us. And final project that I want to share is quite different point of view. South Korea has been ranked #1 in a suicide rate among OECD countries for 13 years since 2005. Because of this shame, the government promotes various policies and national services for suicide prevention. Seoul City has a suicide prevention center. They provide services, mainly counseling and emergency rescue, and besides, they provide prevention activities. According to another statistics, people who left after their family members' suicide have 4 times higher possibility of suicide than normal people. So we consider how we can help them, and we have opportunity to design emotional healing center inside of the suicide prevention center. When we do service design, everybody say the most important thing is empathize the user. But in this project, actually I faced big dilemma. How would I understand parents' broken heart whose child committed suicide? It's impossible to empathize them. And when we design some space for a specific purpose, we have to meet the users and listen to their needs, but we could not meet users because they never want others to know that they are suicide families. So interviews and workshops are only a dream. Without a choice, we had to co-create with the counselors to understand suicide family and try to predict what they would want. Space that we designed open 24/7. We separated 3 different spaces as an education space and home-like space for self-help group meeting and private isolated room for people who have severe emotional status. Inside of the isolated room, we installed VR mental healing system. That VR system is clinically tested, and the core issue in this space was how to perfectly protect individuals' privacy. We have to design very delicately because they could feel privacy violation when we were not fully aware of. So we checked and designed carefully for every possibility of situations when user could be exposed. Since launched this space to now, we couldn't meet them and receive the feedback yet, but we hope they could heal their heart in here. So before I moved to the work for the public sector, I used to design luxurious healthcare services. At that time, privacy was also very important value of the industry. But now in public healthcare sector, privacy is a whole different issues that we have to touch more delicately to embrace their wound and grief. Healthcare environments. Some people lose their beloved ones here. Some people became disabled here. Perhaps people face the toughest moments of their life here. How can we design their moments for better memories? This is the end of my presentation. Thank you.